Patient's 5'3", 179, BMI is 31, and I usually do 360s. Today I'm just going to do the back and the front of the thigh with the fat transfer. She had a previous lipo tummy tuck and didn't want to do her abdomen, which is okay. So we discussed options, and her preference was do the whole back, do the fat transfer, and let's thin out the thighs, specifically from the groin area down to the knee, including around the knee. So we're gonna do lipo from here to here. We're not doing the usual 360s. We're gonna lipo the thigh from the groin to the knee, thin it out, then turn to the side and do our lipo and fat transfer. After, so I'm gonna show you, you can see, nice, much thinner. There'll always be loose skin here. This is the before. All right, we're doing liposuction of the upper back, mid back, waist, hip roll, and expansion of the buttock and hips. If you look at her picture from the profile view, we're going to put up a profile, you can see that she has a pretty flat buttock on the lower half. That's from the cellulite. These particular patients are harder to expand because the cellulite's pulling in and making the skin flat. We definitely get improvements, but if you compare someone without cellulite to someone with cellulite, the person with cellulite is going to be flatter and more difficult to expand with this procedure. We did our liposuction of the back, tiny waistline, expansion of buttock and hips. Remember, if you have cellulite, it's harder to expand because where the cellulite it pulls on the skin and it creates flatness. Fat transfers will improve it, but you won't get full correction. We did lipo of the thigh. You can see there's a nice improvement. I also lipoed her mons. I can't go as thin in the thigh, so the thigh right now is about a 3 centimeter pinch. You can't go as aggressive here as you go in the back because the skin will get very wrinkly, but we got some nice improvement and nice reduction in fullness. All right, lipo of the entire back with thighs. I think, you know, we do a lot of thighs. You don't see it as much. We don't record it as often. But I think one of the take-homes is a lot of times patients have texture issues on their thighs, like dimpling, and they pull up on their thigh. I'm going to show you. They go like this, right? They yank up. The patient yanks up and says, I want my thigh to look like this, and they pull up on the skin. So that's just due to laxity, looseness. Can't correct that. You can do Morpheus to improve it. You could do Renuvion, but it will not be fully corrected. Today we just reduced the fullness. That's easier to do, and we'll be showing you some of her follow-ups. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.